At 1 o'clock, I will begin, as I always do, by thanking you for everything you're doing and continually urging you to tune in right here every day, 1 o'clock, to get the best, most accurate information about the COVID virus here in Rhode Island. It's my hope that after the end of these, you take a bit of a breath and a sigh of relief. I can't sugarcoat it, but you should at least have confidence that we're on top of it. We're doing better than a lot of other states, and we have a team working 24/7 to keep you safe. A quick announcement. Tomorrow, this press conference will happen at 2:30 instead of at 1 o'clock. I have a call at 1 o'clock with all of the other governors. So tomorrow, 2:30, and then back to 1 o'clock for every other day. I'm very sad to say today to report another 4 deaths on account of the coronavirus, bringing us to a total of 8 deaths here in Rhode Island. We have 86 new cases, bringing us to a total of 488 cases. And the most important number that I'm looking at, we have jumped to 59 people in the hospital. By any measure, going from 41 to 59 people in the hospital in one night is a significant and serious jump. It's one that we have our eye on. It's not surprising, it's not alarming, but you should know we're in a rapid spread phase of this disease, and this is going to get much harder before it gets easier. So it's what we've been planning for. It's why right now we are readying facilities all around the state for another couple thousand hospital beds. We are securing ventilators and PPE. We are calling up extra doctors and nurses. We're working with the hospitals on their surge plans. I can't stop that. This is going to happen. What I can tell you is that we're going to be ready as we can, and we clearly have community spread, and we're in a rapid spread phase of the virus. So if you're wondering what you can do, what are you supposed to be doing? You're supposed to be buckling down like you never have before. You're supposed to be listening to the directions that I provide and the Department of Health provides, and you're supposed to be not pushing the limits of these social distancing and mitigation guidelines or orders that we're providing you. You're supposed to be taking what we give you and doing that or more so. I want to be very clear about this. Right now in this country, we do not have enough ventilators to meet our needs. We do not have enough masks and respirators and goggles to meet our needs. In the state of Rhode Island, we do not have enough hospital beds. That's a fact. That's a brutal fact. It's a fact. So what that means is I need to buy us some time. We together need to buy some time. We need to buy a little time to ready the system. More testing, more beds, more ventilators, more doctors. Only one way to buy us time. Every single person out there, staying at home, minimizing your contact with other people, washing your hands for 30 seconds constantly, washing your surfaces. This podium is sanitized before I come out here, after I leave, and several times through the day. So I'm going to keep saying it because mitigation depends on you. And for those of you who are doing it, thank you. A little bit of good news. I want to start by acknowledging that last night President Trump approved a disaster declaration for Rhode Island. You may wonder, why is it good news that we have a national disaster declaration? Because it means that the federal government and FEMA will be reimbursing the state of Rhode Island, cities and towns, and school districts for many of our expenses. They will be reimbursing us for expenses that we started to incur as a result of coronavirus starting on January 20th. So these are expenses for cleaning, personal protective equipment, and other expenses that we're all incurring in order to meet the challenge of the virus. I would like to thank our federal delegation Senators Reid and Whitehouse, Congressman Langevin and Cicilline, who've worked hand in glove with me for the past few weeks to secure this. I especially want to thank my director of the EMA, Mark Pappas, and General Callahan for your incredible work working with me and my team to make this happen. It's a great thing for Rhode Island. It'll give us the resources that we need to fight the virus and to fight the crisis. I mentioned the other day that the most common question I'm getting right now, I'm getting two questions frequently. One is, how long is this going to last? But even more than that, the question is, how can I help? What can I do? How can I help? On Sunday, I asked you to do one nice thing for somebody. I also asked you to write down the list of 5 people who you're going to be in contact with. And I really want you to do it. Write down the 5 people you'll constrain yourself to being near. Today, I have another really important assignment for everybody. I want you to write down at the end of every day where you've been and who you've been in contact with physically, not virtually. So hopefully that's an easy assignment, because the answer will be I've been at home and I've only been in touch with my family. But I want everybody at the end of the day to write down all the places you've been and all the people you've been in contact with. I'm going to do this, and I'm asking you to do this. Because in the event that you get sick, and we hope that you don't, but many people will, it'll help us enormously to do the contact tracing. And when you start to feel symptoms, we're going to have to do the contact tracing of every place you've been and everyone you've been in touch with for several days prior to that. So help us out and keep everyone safe. At the end of every night, write down where you've been and who you've had contact with. Keep a log, and hopefully you won't need it, but if you do, you'll be glad you had it. Next, I have an announcement, like most of these announcements, that I had hoped to avoid, but unfortunately I cannot. As of this Friday, April 3rd, state beaches and parks in Rhode Island will be closed. I wish I didn't have to do it, but this past weekend, Colt State Park, Goddard Park, Lincoln Woods, the public beaches were packed. They were packed with people closely congregated, and that has to end. It should have already ended. It has to end. So we will be closing all the public parks and beaches. It doesn't mean you can't go for a walk. It means they are closed. You can't park your car there. You can't congregate there until further notice. And I know that's going to be hard because we're all super cooped up and anxious to get out. You can still go for a walk. You can still use the bike paths. You can still, as I said, maybe go for a walk on the beach if you're close enough to be able to walk there. But you cannot park in the parking lots, and you cannot do this in big groups. I don't know why people are still doing that. I honestly don't understand why you'd still be doing that. You're risking your life, your neighbors' lives, and hurting Rhode Island. So stop it, but also know that as of April 3rd, we are officially closing parks and beaches. This is typically the time that we are opening campgrounds. They usually start to open in mid-April. We are postponing all campground openings until at least May 1st. I want to make a note about businesses, particularly small businesses. I know it's brutal. If you're a small business, you're getting crushed, and I'm sorry. There's no other option, and I promise you I'm going to get you back up and running as absolutely soon as possible. Having said that, right now, it's difficult, and I would like to make an announcement about a piece of relief for you. Today, starting today, the Rhode Island Superior Court is rolling out a new program to assist businesses whose businesses have been significantly disrupted by the virus. Now, normally, if you're a business and you can't pay your bills, your business is sold or unwound, and obviously your assets are divided among your creditors. We're trying something new, and I'd like to thank the Superior Court. they're putting up a new initiative to enable attorneys and accountants to work with business owners so that they can continue to operate, access capital, such as disaster assistance, and pay their debts incrementally under court supervision. So this new initiative, which you can learn more about on the Rhode Island Courts website, which is courts.ri.gov, is an attempt to help businesses work it out. Work it out, get some leniency, and maybe put yourselves on a payment plan. And I want to thank the courts for getting in there and supervising this. And I'm asking you to save every small business that you can, and to just at least help tide them over until we can get to the other side of this. Testing, as I said, we have a goal by the end of this week to be doing 1,000 tests a day. We are well on our way to achieving that goal. We're not there yet. We're at about 500 or 600 tests a day now, but I believe by the end of the week we'll be at 1,000. I mentioned yesterday that we have large drive-through testing sites staffed by the National Guard at URI, CCRI, and Rhode Island College. All of these sites will be fully up and running by tomorrow. Some are up and running now, but they'll be all fully operational by tomorrow, staffed by the National Guard. Two things I want to mention about this. Number one, expect lines. We're going to do our best to get you in and out quickly. They are drive-through clinics. There's a backlog of tests right now. It's taken us a little while, like every state, to get our testing up and running, so expect lines. We'll do the very best we can to get you in and out as quickly as we can. Secondly, do not show up without an appointment. These are not, they're drive-through clinics, but they're not drive-through clinics. You can't just drive up and be tested. The way to get an appointment to be tested is to call your primary care provider. We have worked incredibly hard with the primary care providers in Rhode Island, and I want to thank the primary care providers for their patience and collaboration. We've worked very hard with them so that you can call your doctor. They'll tell you if they think you need a test, and then you get an appointment at one of these drive-through sites for a test. Please note that you may not get your test result for a few days. Hopefully it's 1 or 2 days. It could be 3 or 4 days. Why is that? We are prioritizing tests for healthcare workers, folks who are hospitalized, and the critically ill. That's necessary. Those folks have to be tested and get their test results back within a day, or as close to that as possible. We're working that. So they're going through one channel. For all the rest of us, we're going through another channel, and we are relying in part on commercial labs. So it could take a day, 2, 3, 4 days. That's going to decrease over time. I expect a week from now, that'll be a quicker turnaround than it is now, but I don't want you to be alarmed. And the truth of it is, you're going to be told to do the same thing anyway, which is to stay at home, unless if you get very sick, and then you'll probably have to go to the ER or the hospital. So please be patient and don't be alarmed if you don't get your results back for a few days. It's April 1st tomorrow, and lots of the end of the month, the beginning of the new month, we're getting lots of questions about utilities and evictions. So I want to take a second to remind people that the courts have delayed all non-essential business through April 17th. That means you cannot be evicted between now and April 17th. So if you're a landlord, listen to me. You are not evicting anyone until April 17th. And after that, I'll be back with further announcements because we don't want you evicting anyone after April 17th either. If you're a renter and you're stressed out and you can't pay rent and you've lost your job and you get an eviction notice, ignore it. The courts aren't open. It won't be adjudicated until April 17th. I'll be back by the end of this week or early next week with longer-term announcements around evictions. Same thing around regulated utilities. Electric, gas, water, and sewer will not be shut off, even if you can't pay the bill, until at least April 15th. And same thing, I'll be back with more guidance on that. Now, as I've said so many times, do the right thing. If you can pay your bills, pay them. If you can pay your rent, pay them. Frankly, if you can pay your taxes, pay them. You know, landlords have a business to run, the state has to keep the lights on, water, gas, utilities. So if you're lucky enough to be in a position that you can pay your bills, pay your taxes, and pay your rent, do the right thing and pay it. But if you're like the many tens of thousands of Rhode Islanders who are barely getting by right now, don't stress. No one's going to shut the lights off or kick you out of your apartment or your house. Last week, I said that I needed volunteers, and hundreds of you responded. I want to make another pitch. We are in desperate need of trained medical and behavioral health professionals who are not at this time working full-time. I'm asking a lot. We need you. We can't get through this crisis without you. We will run out of people. Doctors, nurses, CNEs, physician assistants, therapists, social workers. If you're out there, if you're retired, if you're only working part-time, if you have some extra time on your hands because your practice has changed, I'm calling you up. I'm asking you, please, to respond. I've called up the National Guards, I've called up so many volunteers, I'm calling on manufacturers in Rhode Island, and I'm calling on you. I did it last week, and within a day, 400 people signed up. I want to see, please, another 400 in the next 2 days. Go to riresponds.org, riresponds.org. Last note, we've been at this a long time. We've been at it for a month. And everyone I know is having a combination of feelings: overwhelmed, scared, anxious, going crazy, generally, being stuck in their house, frustrated. And everybody wants to know, when's it going to end? So this is my best advice for you. Take it a day at a time. Try to get through today. Reach out to us if you need help. Do everything you can to do something kind for a neighbor or a friend or a family member. And know that, even though I don't know how long this is going to last, know that every day we're going to get a little bit better at responding to the crisis. So very, very soon, I hope to have announcements around better food delivery for folks that are in quarantine, better access to mental health for kids and for adults who just need somebody to talk to, better ways to track your systems, better ways to track your symptoms, more, faster, and better testing. There's one thing I know is that we're going to get to the other side of this. I don't know exactly when, and it won't be forever. And I do know that Rhode Island is in better shape than a lot of places. And I also know that panic and meanness isn't going to help at all. So if you have it in you to check in on a loved one or a neighbor or even a stranger through social media or a text or to call them, please do it. And if you're feeling totally overwhelmed, call BH Link, call Kids Link. If you're a business, call 521-HELP. And just know that every day we get a little stronger and a little better at meeting your needs. And I hope that in a week or 2 weeks or 3 weeks, even though the virus will be much more widespread and there'll be many, many more cases, our system will be that much better to deal with it.